So you have been diagnosed with breast cancer. Today I'm going to be talking about certain things that may help you move forward after your breast cancer treatment. My name is Dr. Tasha and I'm a breast surgeon. You are not alone. 1 in 7 women will get breast cancer in their lifetime in the UK. Around 55,000 women and 370 men will be diagnosed in 1 year. Unfortunately, there are many people who are currently either going through treatment or have come through the other side. The curious thing is, you will suddenly realize that there are more people around you than you think who have had breast cancer. Suddenly, all these people are appearing. Friends of friends, colleagues at work, celebrities, old school friends. So you are definitely not alone. It's okay to feel scared. Getting told you have breast cancer can be the scariest thing in the world. Your life changes in an instant and you have so many things whirling in your head. Suddenly, you have fears and feelings you probably never have experienced or thought about before. You become aware of your own mortality. You wonder about your future, your family and friends, and it's okay to feel scared. In fact, it's only natural to have these feelings. You will find that you'll have emotional highs and lows. On some days, you will feel absolutely fine, and cancer will not be on your mind at all. You will live your life day by day without any care in the world. On other days though, you may have emotional lows. The fears and anxieties will creep back. So expect this roller coaster of emotions. The peaks and troughs may become less frequent, but it may never go away. Being selfish can be a good thing. This is something that I give you permission to be. Yes, be selfish to be kind. And you know what? You mustn't feel guilty about it. Being kind to ourselves is something we need to do more often. If it means that you have to be a little bit selfish to achieve it, then that's okay. So if you want to lie on the couch and watch Netflix all afternoon, then go for it. If you don't want to meet up with your friends for dinner, then politely cancel it. And if you want to treat yourself and buy that cute bag you have had your eye on for the longest time, then you go, girl. Be selfish. You'll thank me later. You may lose old friends, but gain new ones. Losing friends when you have had a breast cancer diagnosis is something I hear far too often. And this can be difficult sometimes. Unfortunately, many people don't know how to act and behave when somebody's been diagnosed with cancer. People don't know what to say. They worry about saying the wrong thing or have what may be perceived to be challenging conversations. So instead of being the friend that you need, they shy away and eventually lose touch completely. The thing is, there is a large and active breast community out there. You can connect with others, and before you know it, hopefully you'll gain new friends. You may continue to get side effects from treatment. Now this is the real deal. Unfortunately, whether that's after surgery, chemotherapy, radiotherapy, or endocrine treatment, it is likely you'll continue to have side effects. Stiffness, pain, lymphedema, peripheral neuropathy, hair loss, weight gain, joint aches and pains, loss of libido. The list is endless. And these can be difficult to manage at times, especially if they continue to affect you. So if this is the case, please do go and see a doctor who hopefully can help. You should eat well. Making sure that you continue to nourish your body with all the nutrients it needs to heal and function is so important. And there are a lot of myths and misinformation out there about what to eat, what not to eat following a breast cancer diagnosis. The best and easiest way to think about food would be to eat the rainbow. In other words, fill up your plate with foods that are colourful, which will make sure you include lots of colourful veggies on your plate to increase variety and diversity. So rather than removing certain foodstuffs, why don't you try and incorporate other foods instead? Movement is essential to recovery. Okay, this is not a surprise. We know that being physically active can help minimize the risk of developing so many diseases: cardiovascular disease, high blood pressure, diabetes, and obesity. However, we also know that exercise reduces the risk of breast cancer recurrence. And a recent study found that 150 minutes per week of moderate activity can lead to 50% reduction in recurrence rate and mortality. So aiming for 2.5 hours of physical activity a week can have a positive impact. But if you can't do that, then any exercise or any movement is better than no movement at all. A breast cancer diagnosis is life-changing, and there will be roadblocks, hurdles, and difficult periods, but at the same time, these challenges may offer positivity and unexpected revelations. My hope is that you can move forward from a breast cancer diagnosis and continue to live the life you were meant to live.